Home care invoice came in the mail. 3 weeks round the clock care while mom recovered from stroke. $18,000. The daughter looked at it twice. She looked at the invoice. Then she called Medicare. The voice on the other end was kind, but very unmoved. She said, "Ma'am, Medicare does not pay for that. Medicare pays for nursing. Medicare pays for therapy. Medicare doesn't pay for help." The daughter sat down on the kitchen floor and cried for an hour. And then, because she's the one in the family who handles things, she got up, opened up her laptop, and started learning what she should have learned 5 years earlier. Today's episode is so that you don't have to learn it on the kitchen floor. So we're going to take a look at the gaps. We're going to look at what the gaps that are open. My name is Emma Soy. I am the founder of Gentle Shepherd Care. And welcome back to this week's webinar. Last week in part one, we laid the foundation that Medicare is a health insurance program. It was built for medical care, not long-term care. It pays for hospital stays, up to 100 days of skilled rehab, intermittent home health visits when there's a skilled need, and hospice. That's the good news. Today's the harder news. Today, we look at the gaps, what Medicare will not pay for, the 100-day myth in detail, a real family story, and 5 things you can do this week to close the gap before the gap opens up underneath you. I have a quick disclaimer. This is just for education, not legal or financial advice. For your specific situation, work with your licensed professional. And so here we began to talk about the gaps. Custodial care is the term that I would like for you to, I don't know if you've heard it before. This is the term that Medicare use. This is the term that Medicare use when they talk about long-term care, custodial care. It is the help that makes long-term care long-term. Bathing, dressing, toileting, queuing, supervision, 24-hour home care, most adult daycare, most home delivered meals, personal care help with activities of daily living when that's the primary need, meaning when there's no skilled service driving the visit, long-term residence in assisted living or nursing home. Here's the number that keeps me up at night. About 70% of Americans turning 65 today will need long-term care services at some point in their lives. The average length of need is around 3 years, and Medicare does not pay for it. Medicare supplement, which we called Medigap, those are Medicare policies that fills that Medicare gaps, but they follow Medicare's rules. If Medicare do not pay for something, they don't pay for it either. Some Medicare Advantage plans now offer some limited supplemental benefits, things like a few hours of in-home health, but they are not a long-term care solution. So before you sign in the dots, read the plan documents very carefully. Most families hear 100 days and plan around 100 days. The actual average length of a Medicare covered skilled nursing stay is around 21 to 30 days. Why? It's the improvement standard. The improvement standard in practice, even though the 2013 GEMO settlement said Medicare cannot deny coverage solely because a patient is not improving, that maintenance therapy is covered when needed to prevent decline. In practice, plans still cut when progress slows down. Your loved ones has appeal rights also, and we'll teach you how to use these appeal rights in a few weeks, and to show you how you can fight Medicare denials. But today, the takeaway is simpler. Do not plan your family's life around 100 days. Plan around 21 days. I do have to end this with a story. Let me tell you about this particular daughter. And I'll call her Rebecca. The name and details are changed, but the story is real. Okay? Tuesday afternoon call. Mom in rehab 3 weeks after a stroke. The notice came that morning that Medicare ending on Friday. Mom can't be home alone. Rebecca has a job, a husband, and 3 children. She had thought she had more time, but she did know mom needed roughly 24/7 supervision, at least for the first 4 weeks at home. The cost for this in our market around here is $18,000 to $20,000 a month. What we did for her in 36 hours, we did in-home assessment. We created a graduated care plan that started with 24/7 and stepped down to 12 hours a day by week 3. We used the long-term care policy that her mom had, that her mom's husband was paid for 22 years. We did an application for VA survival benefits that her mom got from her first husband. And so by month 2, the long-term care policy was paying $4,500 a month. The VA was paying $1,500 a month. The family was contributing modestly, and mom was safely at home. This is solvable. It's rarely solvable in 48 hours, though. The families who comes through this best are the one who learned what we are teaching today, because the discharge phone calls way before the discharge phone calls comes in. And so here's are the 5 things that I really would encourage you to do today. Number 1, confirm what kind of Medicare your mom or dad has. Do they have original Medicare, or do they have a Medicare Advantage? They have different rules and the appeals are different. Next, have a conversation with your mom's or dad's primary care doctor. Bring the idea. Ask them, if needed, would they qualify for skilled home health? Find out. Find out now before they actually need it. Map out on paper, not just in your mind. What would happen if your mom or dad needed help tomorrow? Who would show up at hour 1? Who would come in at hour 8? Who would be the overnight person? Now, estimate the gap. Look at what Medicare will cover and what it won't cover. The coverage quick reference guide make it very easy. So if you didn't ask for it last time, reach out to us and ask us for it. Make a backup plan. Who pays? Where do they live? Who provides care? Even a rough plan is dramatically better than having none. Most people don't have any plan and they're just reacting to crisis. And we also today offering that Medicare coverage quick reference guide. If you didn't ask for it last time, reach out to us, ask for it. Give us a call at 704-209-5040 or send us an email, emmasoy@gentleshepherdcare.com, and I will be more than happy to quickly send that to you. So now you know what Medicare does and does not pay for, which means you also know for most families needing long-term care that the money has to come from somewhere else. There are exactly 4 other places money would come from when we talk about long-term care. Number 1, your savings. Number 2, Medicaid. Number 3, the VA or long-term care insurance. Those are the places where money comes from for long-term care. Next week, we'll talk about Medicaid planning. Part 1, the program that becomes the answer for most middle-class families, but only if you understand it 5 years before you need it. And so next week, we'll cover that. We'll show you the strategy behind how to plan ahead. So we'll see you then. Until then, hold the Medicare card, map the gap, make one call this week. Don't let the next phone call you don't let the next phone call you take be the 8 p.m. one because it'll be too late. I'm Emma Soy. This is Gentle Shepherd Care. I'll see you next time.